I'm David Taffet with DVTV News, and we have breaking news from Prism Health North Texas and Uptown Physicians Group. I have Dr. John Carlo, who's the CEO of Prism Health, and Dr. David Lee, who's the founder and president of Uptown Physicians. First, tell us what each of your organizations do.
Well, David, thanks for having us here today. Prism Health North Texas, since 1986, has been here in Dallas, and what we really strive to do today is offer the very best in access to HIV treatment and prevention. And we're located in areas where we've been heavily hit in Dallas in terms of where the epidemic is. So thankfully today we have great services and support for the many clients and patients that we see in this area.
And Dr. Lee, tell us about your organization.
So Uptown Physicians Group was formed in 2005 with Dr. Brady Allen, Dr. Robert Henderson. We mainly served private insured patients, mainly focused to the LGBT community, HIV care, pre-exposure prophylaxis, and general medical care for the community.
So, Dr. Carlo, tell us what the announcement is.
Well, I'm thrilled to be making this announcement today that Uptown Physicians Group and Prism Health North Texas are going to join forces. And together as one, we really see an immense opportunity to go into the future and provide even more services and more support for people in North Texas.
So tell us what the timeline is for this to happen.
Well, we're making the announcement today, and the exciting part is what the future looks like going forward. But the good news, though, about what we're doing is we don't have to make immediate changes. So the good news is today, there's really not going to be any changes for our current patients. Uptown Physicians will continue to operate the great services they do. We'll continue doing the same services we do. What we'll gain over time is actually efficiency by working together. And those efficiencies will enable us to have more patient access and services going forward.
And when you say more patient services, you're talking about opening new offices? What types of things are you talking about?
It's very possible. You know, the opportunities, because we're bringing in such a great experience with Uptown Physicians Group, the great doctors, the physicians, and the providers that are there, we see a tremendous amount of opportunity to go forward and build new buildings, go forward and find new access points. It's certainly going to take some time, of course, but really this is about the first step. The first step here today is the partnership, really getting the talent together so we can get together and build what's possible.
So what's the staff response been?
It's great. Everybody's on board. Everybody in my clinic sees the need that's out there. Everybody thinks because we take insurance, all our patients have all their needs met, but that has not been the case. I actually started practicing in 2002, and when I started, patients would pay $20 copay, get their medicines. It wasn't an issue, but now patients are expected to pay $5,000, sometimes $10,000 out of pocket before the insurance pays a dime. So that's unreasonable. Patients cannot afford to do that. So with this partnership, Prism will be able to help our patients that qualify to help pay their medication copays, help continue if they lose their insurance, help continue their insurance so they can stay in care and stay healthy.
And it sounds like you'll be able to help more patients.
I absolutely. You know, the challenges today is that, just as Dr. Lee is saying, insurance only covers so much, and we need all the resources together so that we can provide the best possible services. So whether you don't have insurance, whether you have insurance and you can't afford it, or if you have insurance and don't need any support, we think that this partnership is going to allow the opportunity for all of these patients to have great service, great health care. We share the same vision on service, and so we're coming together because we've known each other for a long time and know what's important, and that's really what we do for the community and what we can do.
So what prompted this change all of a sudden? Or is it something that you've been building up toward?
We've been slowly building up toward it. You know, the needs have been increasing. I know in my practice, I'm sure in your practice too. Patients need help. What we've relied on in the last couple of years are copay cards or manufacturer rebate cards. Without those, honestly, our patients would not be able to get by. I don't think that's a great plan, only relying on that. We really need to reach out and build partnerships with Prism to be sustainable long-term wise and really to help more patients.
Now, you've participated in LifeWalk for years. You're the recipient of LifeWalk. how will LifeWalk be affected?
Well, LifeWalk's not going to change. LifeWalk's a community event that Prism Health North Texas helps facilitate, but really the funds go to many other organizations in this community. And what we see is our purpose in facilitating LifeWalk is to continue to raise that awareness that there is still a problem with HIV and AIDS in this community. And we're very happy that we're going to be continuing that.
We are coming together. Uptown Physicians will become a nonprofit organization. We are combining forces.
So the fundraising will help patients who go to any of your offices because it's all the same organization.
Exactly.
Right? Yeah. So what will change?
Well, let me just start with what will not change.
Okay.
What will not change is the patient experience. So if you're a patient coming to Uptown Physicians Group, you can get on your portal, you can make your appointment, you'll be greeted by the same receptionist, the same medical assistant or nurse will bring you back, and you'll see your same provider, your same doctor, physician assistant, or nurse practitioner. So nothing there will change. For most patients, they won't see any change whatsoever. Prism will be there to help those patients out if they qualify, which is huge for our practice.
For us, one of the things that have happened to us is we have more and more patients that have insurance. And, we started a while back only seeing people without insurance. But thankfully now people are healthier. We have more access to health insurance. So what we benefit by this is the expertise of how to manage health insurance. And we build that with our experience with grant funds and public funds to really generate the best possible team, the best possible use of the resources.
And you've done a number of trials, and you have too.
We have in the past. We're not currently doing.
You're not currently doing any. Will that change at all?
Well, it won't change immediately because of just the technical aspects of getting research enrollment, but I do think that we do see this as another opportunity. There is always the opportunity for collaborations, and anytime you're doing research studies, it's always important to raise the awareness of potential, eligible patients who may be interested in those types of studies. So,
and our patients will have access to the trial, so if they need to participate.
Okay, so will the names of either of the organizations change?
No, we will still be Uptown Physicians Group. Those will be Prism Health North Texas. But the thing we share is a common goal. Patients in North Texas, in particular GLBT patients, they deserve quality health care regardless of their ability to pay.
Will there be any staffing changes?
No staffing changes. The same great teams of clinicians, staff support for Prism Health North Texas will remain the same. Same great teams at Uptown Physicians Group are going to be on the same same page. So the difference actually is all of that administrative costs of running a healthcare practice. We will actually have joining the resources so we don't duplicate all of that unnecessary stuff that's really costing us a lot.
Now, you've run a number of other programs as well. Will any of those change or be discontinued?
No, none of our current programs right now are going to change. We've got a long history of programs that really reach our patients and clients where they are. So our same services and support for those that need housing, same services and support that are needing access to substance use treatment, mental health services, working with our reentry populations, all of those things are going to remain the same.
And I guess anybody at Uptown Physicians who needs any of these services will be able to access them now too.
And we definitely have the need.
Talk a little bit about health inequities.
Well, Dallas has a lot of health inequities, and I will say that this community, if you look at other communities like us around the country, there is always a health center that addresses specifically with health inequities, whether it's the LGBTQ community or specific neighborhoods. There's always an organization that is tackling those challenges, and I think Dallas deserves an organization that can tackle those challenges. The goals of this partnership is to reach more patients with more affordable services and impact the health of the Dallas community.
And for the patients in care, to help the patients that really need help currently.
Dr. Carlo, Dr. Lee, I want to thank you both for being here. Please pick up this Friday's Dallas Voice for more in-depth coverage on this new partnership.
Thank you.